Do you often feel like your body just can't fight off even a simple cold? Or maybe your child keeps getting mouth sores or sore throats every few weeks. If so, it might not just be bad luck. These could be signs that the body is missing a key defender, white blood cells called neutrophils. Neutrophils are like the body's security guards. They rush to the scene when bacteria show up, like when you get a small cut or catch a cold. In conditions like cyclic and congenital neutropenia, these guards either come and go in cycles or are missing from birth. That makes even tiny infections turn serious. Think of it like having a house with locks, but the security team never shows up when someone tries to break in. That's what life can feel like with neutropenia. For congenital neutropenia, it's usually due to a faulty gene passed from parents. Imagine a factory making cars, but one tiny gear is broken. The whole car can't move. In the body, bone marrow makes blood cells, but a genetic error stops neutrophils from growing right. For cyclic neutropenia, the issue is like a clock that resets every 21 days. Your neutrophil levels drop on schedule. It's not caused by germs or diet, but often by genes too. For example, a mom might notice her child gets a fever every 3 weeks, like clockwork. That pattern is a big clue. These are not lifestyle-caused problems. They're built in, not invited in. How do you know if someone has neutropenia? Let's say your child has mouth ulcers every month, or you keep getting skin infections that just won't heal. Even a simple gum infection might turn into something worse. Common signs include fevers without a cold, sores in the mouth, pus-filled spots on the skin, or repeated ear infections. For babies, it might look like constant crying from throat pain or not gaining weight because eating hurts. Some people even get stomach pain or diarrhea when gut infections sneak in. Since there are fewer infection fighters, even small bugs cause big trouble. Think of it like a town with no firefighters. The smallest spark becomes a wildfire. How do doctors find neutropenia? They start by asking, do infections keep coming back? Then they draw blood, usually every week for a few weeks, to see if neutrophil numbers go up and down in a cycle. For congenital types, they might do genetic testing, like checking the instruction manual, DNA, for typos. A key sign is when neutrophils stay below 500 cells per microliter for long periods. Treatment often includes a medicine called G-CSF, like Neupogen, which is a signal flare to the bone marrow, make more neutrophils. Most people respond well. In rare cases, if that fails, a bone marrow transplant, like replacing the whole blood factory, might be needed. The goal: keep infections away and live fully. Can you prevent something you are born with? Not exactly, but you can prevent infections that take advantage. For example, imagine your immune system is like a weak wall. Instead of waiting for a storm, you build a roof. Simple habits help. Washing hands daily, avoiding crowds when sick, not sharing toothbrushes, and keeping cuts clean. Dentists also help. Regular cleanings stop gum infections before they start. For kids, schools should know about the condition so they stay safe during flu season. Vaccines are key too, like giving your body cheat codes to learn enemy attacks. While the low neutrophil count cannot be avoided in these cases, smart living can stop infections from breaking in. Science is making progress. In recent years, researchers have used gene therapy to fix the broken instructions in bone marrow cells. In one study, babies with severe congenital neutropenia had their own cells edited and put back, like fixing a single wrong letter in a book. Others are working on smarter drugs that boost neutrophil production without daily injections. Also, apps now help track blood counts and symptoms, like a personal health diary that alerts the doctor before an infection hits. One family used it to notice a dip in blood cells before a fever started, so they acted early. The future: less guessing, more control. It's not a cure yet for all, but hope is growing.